guess we'll start off, Aaron. Do you want to tell some of our viewers a little bit about yourself? You're Aaron from Squat University, so I guess that would make you the professor of squat.
Definitely. That's a good way to put it.
There you go. Classes in session.
Yeah. So a little about myself. I am a doctor of physical therapy. I work out in Kansas City, Missouri at a place called Boost Physical Therapy and Sports Performance. My background originally is in exercise science. So I got my undergraduate degree from Truman State University, which is a small D2 school up in northeastern Missouri. Okay. That's where I first started Olympic weightlifting. So that was back in 2005. So it's been about 12 years now that I've had experience competing in Olympic weightlifting.
Well, hold on. How old are you, man? Because you look like you're like fucking 22. First question right off the bat. 31 this year. First question right off the bat is, what's your moisturizer then? Let's start this off.
It's highly confidential. I can't really give away the secret now.
Okay, continue. Sorry, go on.
So I went to the University of Missouri, or Mizzou, for grad school to get my doctorate, which is another 3 years. So 7 years total of college.
Damn.
Yeah, it was a good time. And then I've moved out to Kansas City, and I've been over here for coming on 6 years now, working at Boost Physical Therapy, where I'll see athletes of all ages. So I'll see kids as young as 8 years old, some professional football players, CrossFitters, and then all the way up to grandma who just had a knee replacement. So we see everyone, but our main specialty, I guess you would say, is young, high school, college age athletes.
And what really gravitated you towards the squat in particular?
For sure, great question. So the big thing with that is during our evaluation, no matter what type of injury it was, whether it was ankle pain, knee pain, hip pain, back pain, there's a point during the actual evaluation where we get to the physical examination, basically, where I want to see you move. I'm going to check some things out. And I always get to the point where I ask them, let me see you perform just a simple bodyweight squat. Now, I would have people who were, by every means of the word, extremely strong. I'm talking football players who could squat 450 pounds, 500 pounds with ease, but for some reason, they're still having pain. There's something still wrong. And it became apparent whenever we got to the point where I asked them just to perform a simple bodyweight squat. Take your shoes off, point your toes relatively straight forward, and there it was. There was the problem, is so many people could not perform just the most basic movement of the squat. And let alone double leg. If I ask you to do a single leg, which would be the next thing, I mean, so many people, especially my powerlifters out there, they're like, dude,
you just said that. I'm like, please don't put me on the spot right now to do one. I'm like, God damn it.
Exactly. I mean, I have guys that were, extremely, extremely strong that could not perform the most simple movement of a deep bodyweight squat. And it's because, as a society, I think we've sort of rearranged our athletic priorities to such a point where we think that the squat is only an exercise. So we only do that movement when we're in the gym. And we don't think about it throughout our day. You go to the third world countries, people still talk about the third world squat. You go over and they're not sitting in chairs. People are sitting down in a deep bodyweight squat, right?
Yeah.
But how many of those people have back pain? When you look at today's society, in America, 80% of people at some point in their life are going to have back pain. You ask so many people, hey, can you sit down in a deep bodyweight squat comfortably for 2 minutes? Everyone is like, are you serious? Why would I ever do that?
It's funny. It's funny you said that's exactly what I was thinking. Why the shit would I do that?
So we wonder why we have all these injuries, yet when you break it down to the fundamental movements that we can perform throughout our day, the squat is the one basic fundamental movement that we've lost the ability to do as a society that I've seen. So across the board, our athletes are bigger, stronger, and faster than we've ever been before. Every single day we're breaking new records. I mean, specifically talking about barbell athletes in the squat, I mean, you look at Ray Williams, who I know you guys have talked to before, a freaking amazing athlete. He's squatting more weight than we could ever imagine possible and doing it raw. Yet, there's still a problem because we're having more injuries now than ever before. When you ask an athlete, hey, have you had knee pain before? Almost every single person's hand shoot up. Have you had back pain? Have you had hip pain? And when it comes down to it, I think it's because we don't value the quality of our movement in the way in which we go about our day being able to express this fundamental movement. And what I find is that when you switch things up, you change the game, you learn how to perform a basic squat, and you put technique over how much weight's on the bar, a couple things happen. First, you're going to be able to reach more weight, more potential, because you're setting yourselves up to move more mechanically efficient. So when technique is the biggest priority, you're going to eventually be able to lift more weight. Second, and the most important according to me, is that you're going to be able to do so pain-free. Because while I think it's important, as an athlete, obviously we have very big production goals. While I want you to be able to be capable of that, I also want you to be able to walk around and play with your grandkids when you're 60. I don't want you to be stuck in a chair because you've had horrible hip pain, you've had 2 knee replacements, because you damaged your body so badly while you were in your 20s and 30s, pushing more weight, and doing it with bad technique, and then eventually your body breaks down. And so I'm coming from a longevity standpoint as well.
And do you find that of all the movements, you focus in on the squat? Is that probably the most common exercise that athletes use across from sport to sport to sport?
Oh, definitely. I think every single athlete, no matter what sport you're in, the squat in some variation is going to be a part of it. I mean, if you look at it, the deadlift is almost the same, but in order to get into the position to pick the bar off the ground, you're performing a squat. The Olympic lifts are something that I obviously have as a big part of my life, but not every athlete's going to be performing the Olympic lifts. I mean, football players to a point have the power clean in many of their training, but you're not seeing a baseball player perform a full snatch. Yeah. But in order for a third baseman to get down to the position to be able to grab the ball, what are they doing? They're performing a squat. Yeah. So the squat sets the foundation for so many other movements that you're doing. If you're going to jump and land to grab a basketball, you have to perform a squat. So what I find is that if you can rearrange those athletic priorities and learn to move well first and be able to set that fundamental foundation of having a good quality squat, it allows you to do so many other things pain-free and with ease.
So what do you think are the most common problems people have when they do the squat?
Yeah, there's a number of things that I see people go around. The first thing has to be with the feet. So the feet are like the base to your body's house of cards. And if your feet aren't in a good, firm foundation, the entire technique just goes haywire after that. So you see most people, you want your foot in a good arched position the whole time. Now, some people have anatomically flat feet, so there's only so much they can do. I always talk about the foot as like a tripod. So this is my foot, you've got the base of your heel, you've got the base to your first toe, you got the base to your fifth toe. Now, if those are 3 down at the same time like a tripod with equal weight through each one of them, your foot is going to be stable and allowing the rest of your body to move with good technique because you're not moving over a faulty foundation. So the first thing I look for is the foot. What we see a lot of times is that as people squat, their foot collapses over.
Yes.
Or their feet spin out, which could be another problem because they've got too much weight. They're driving their knees too far wide. So that's a big one too. So I always look what's going on at the feet first. I guess the second thing would probably be ankle mobility, which is huge. Now, as a power lifter, if you're using a low bar back squat, which not everyone does, but is more common with powerlifting than weightlifting, you don't need as much ankle mobility. The ankle mobility we express is dorsiflexion, which is the knee going forward over the toe. Now, for people who are performing a high bar back squat or a clean or a snatch where you need to have your chest fairly upright, you need to have more ankle mobility because the more your knee can translate further forward over your toe, the deeper your hips can sink and the more your chest can stay upright. So what we find is that a lot of people, because of their ankle restrictions, it limits their ability to keep an upright chest. So as they go forward in their squat, their chest will just cave over, their low back will round excessively. So by improving their ankle mobility, it allows them to show much better technique. So that would probably be the second area. And then the third would probably be knee collapse. I know we've all seen videos of it. You got someone, on YouTube that's lifting a ton of weight and their knees just collapse.
Yeah.
Kills me.
So what sets that up? What's that issue? Or could there be several issues for that?
Oh, it could be several issues. A lot of people instantly, which is nice that people are automatically starting to understand this, is a lot of people will go, oh, it's hip strength. Because what we've come to find is that your glute medius, which is the outside hip muscle, it almost controls a lot of the knee waver side to side. Now, it's awesome that I see people point to that, which is great, but it's not the full story. Because if you take a lot of athletes that have that problem, and in physical therapy, there's a way we lay them down their side and we can test, called a manual muscle test. We can test for the strength of that muscle. Now, athletes, especially the most elite ones, are not weak at all. So I'll set an athlete down that's showing that knee collapse, and I'll test that hip, and it's very strong. So then what's the problem? A lot of times what we find is that it's a coordination issue and not just a strength issue. So coordination comes down to timing and when that muscle is firing, basically, and how hard it's firing. So a lot of times if you see that athlete squat, catch a clean or a snatch, and those knees come in, it's because those hip muscles aren't firing at the right time to keep the knee in direct mechanical alignment with the foot. So it'll waver in as a quick, basically, response because those hip muscles aren't firing at the right time. So it's not that they're not strong, it's that their muscles aren't firing at the right time. So it's a motor pattern problem.
And how would you address something like that then? Because that's probably one of the most common things that viewers are going to have is the knees coming in.
Exactly. So you have to break it down and find out where the most, I guess, problematic weak link is. A lot of times I like to go single leg. So like I said, during that evaluation process, we look at a couple things. First thing I say is take your shoes off and let me see that body weight squat. Now, sometimes most people will be able to show a pretty good, body weight squat, especially if they've worked on it for a while. What happens next, though, is I tell them, show me a good single leg squat. And that's where most of the time goes haywire. If that knee is just wobbling around like crazy, diving in, there's your problem. Is the squat is not only a double leg movement, but a single leg one too. And you have to have that much more control, mobility, coordination with single leg than you do with the double leg stance. So a lot of times these athletes that show that bad knee collapse in a double leg, I will break it down, show them and expose it in single leg how bad it is, and then we fix it from there. So we'll do, it's called a touchdown squat. It's basically a modification of the pistol squat, and you're going down like 2 inches and back up. And a lot of times that's extremely difficult for people. And I'm talking guys who can squat 500 pounds.
I've tried it, man. It's super. Anybody watch it, man. It is crazy hard, man.
And it's all about perfecting it. So it's get the hips back, squat down, keep the knee in line, keep the foot stable, because a lot of times that foot will collapse over. So just cueing the athlete, hey, what are your feet doing? They don't even think about it. Throughout their squat, they're thinking hips, they're thinking core, they're thinking the bar on their back. They don't even feel for what their feet are doing. So a lot of times just sort of almost making it known to the athlete, hey, your foot needs to stay stable, automatically sets the hip in a good position and allows them to show much better knee control. And then we build it back up. Now, there's a number of different exercises we can do. For example, there's like a banded kick out to the side. There's band walks. I know the slingshot. I know like Mark Bell, he's got the thing where, you put it around your knees. That works as well. But basically, it's cueing. What you're doing when you're putting that band around your knees is you're inviting tension into the hips before you even start your lift. So you're cueing those hip muscles to turn on before you even start your descent, which again is addressing the coordination problem.
So you would say would that be something that all powerlifters or athletes in general should do? Like, what is is that a good warm-up, is start doing these cues?
No, it's great. Now, not every single person has those problems, but it's a great thing to warm up. So what I'll do is, depending on the athlete, is sort of, it makes the exercise either a corrective exercise or a warm-up. So, for example, if I have an athlete who has really bad knee control, I'm going to be having them do 3 sets of 20 touchdowns just to coordinate that knee control. And then they may do a number of other things before they even get to their actual workout. Now, if it is someone who shows pretty good knee control, they've got a great squat right now, I may have them do just a couple, 3 sets of 5 or something like that as their warm-up, just to sort of prime those muscles. But they don't need to be spending a half an hour prior to their workout fixing those things because they're already showing good technique. But by going to a single leg and just training it every once in a while, you limit the potential for these issues to, come up in your training eventually. So you're basically working on basically correcting 4 weaknesses before they even happen, if that makes sense.
And if you have, what I see often, I think a lot of people, especially powerlifters or athletes in general, have one side that's a little stronger than the other. one side, whether it's the leg, the hip, especially if you deadlift a lot and you're overhand, you do an over-underhand, you don't do hook grip, the whole one side of the chain gets a little more tighter. And then I notice even with myself, like it comes through in the squat where I feel it in the glute and the hips on one side so much more. Is that where you would be doing the single leg pistol squats and
exactly? Yeah, that's the big thing. Is a lot of times, you know, barbell athletes, they won't really feel or notice that they're developing these side-to-side asymmetries, what we call basically side-to-side weaknesses, until you put them in a position to really expose it. So that's why, you know, we'll work on those I think every single athlete should work single leg, whether it's, you know, a couple times a week if you're just sort of preventing a problem from, you know, coming up, or if it's you've got a big problem, you need to definitely work on this before you're training. But doing those side-to-side single leg things really can keep your body moving as it should. It prevents coordination problems and keeps it working as, you know, efficient as possible. So the single leg squat's huge as well. Another one I like to do is a single leg bridge test. I showed it on my Instagram a couple weeks ago, but you're just down in a single leg bridge. You pick your hips up and you're just holding it there for a couple seconds. And the goal is to feel for what muscles are kicking on. So if anyone's watching this, you know, get down and on your back, do a single leg bridge, have one leg in the air, and feel after a couple seconds what muscles are burning like crazy. Now, for a lot of people, they'll feel their back kick on. They'll feel their hamstrings cramp like crazy. Some people even feel their quads working a lot. What you should be feeling are just your glutes, maybe a little hamstring, but mostly your glutes. And what that's showing are what are your go-to muscles for producing hip extension. Now, with a squat, that's pretty obviously, that's driving up. For your deadlift, that's driving up from the bottom. If your glutes are not your go-to muscles, your body's already moving in a, you know, compensated way, and you're going to develop eventual issues, back pain, hamstring strain, things like that, because your body's not working as it should.
So what would be some corrective measures if someone does do this test and they find like, holy smokes, man, it's not my glutes? What are some corrective measures? Would be is there like assistance exercises to try to even that out, or?
For sure. So if we measured and did the test in single, we correct for it in a double with purposeful cueing. So let's say when you did that single leg bridge, you felt your back working like crazy. What that's telling me is you're going directly to your back extensors, your erector muscles, before your glutes. So what we'll do is we'll get you down double leg. We're going to cue to brace your core first and then lift your hips. So I'll have you on your back and I'll cue you. Pretend like you are going to get punched right in the stomach. And what that's going to do is it's going to turn on core stability as it should. Because remember, stability is the ability to limit excessive movement. It's not just strength. Because a lot of people, they train their core to be extremely strong. They do crunches all day long. They do back extensions, the GHD machine. But they don't work it necessarily for stability, which is to limit that excessive movement that we don't want. So right there, I'll say, cue like I'm going to punch you right in the stomach. They're going to turn their core on. You'll feel those muscles kick on extremely strong. Then lift your hips up. Squeeze your butt muscles as hard as you can. Drive your heels in the ground. And instantly, if they're doing it correctly, they won't feel their back at all, and their butt muscles will be burning like crazy. That's sort of your go-to. You're doing it right. So I would do something like that. I'd probably give you a ton of reps because, again, we're retraining a movement pattern. Just doing 2 sets of 5 is not going to do anything. I need a lot of reps. So I might tell you 2 sets of 20 reps with a 5-second hold, squeezing your glutes as hard as you can with an isometric squeeze. You know, and if you're doing it correctly, eventually it's going to carry over to other movements.
And if you have an athlete who does have one side strong and the other one side's lagging, and you do the single legs, would one leg get more reps than the other, or do you always train the same amount?
I'd probably train the same amount. Now, if you're in pain, I may do 2 sets on one side, 1 set on the other, but I never want to only train one side because the same reason that you developed pain on that side could be the same reason that could eventually lead to pain on the other side. So I always want to make sure that we're balancing the body out because in the end, our goal is to have that purposeful, coordinated movement on 2 feet during our squat, our deadlift, our clean, whatever barbell movement we're doing.
Okay. And another question. So a lot of people ask too about, and I know me and Randy have had this discussion, between high bar, low bar, when you should choose, when you're an athlete, which one you should do when you're working with athletes. as well as wearing a heels or flats for high bar or low bar, which one's better, etc. And foot placement, what changes when you're high bar to low bar in terms of foot placement, in terms of hand placement, and there's like a bunch of questions rolling through. And also when you switch from flats to heels, foot placement, hand placement, high bar, low bar, etc.
Definitely. Okay, so let's break down the first one, high bar versus low bar. The big thing I always say with that, go with what feels most comfortable. Now, I know a lot of people that are powerlifters, they still squat high bar. You know, they feel most comfortable, they feel most powerful in that. That's completely fine. Just because you're in the sport of powerlifting doesn't mean you automatically have to squat low bar. You know,
that's true. That's like a stereotype for sure.
Yeah. Now, a lot of people do, because what happens is that when you squat low bar, because the bar is lower on your shoulders, obviously that's the name, it's going to tilt your chest more forward in order to stay balanced, which means the bar is tracking over the middle of your foot.
Yeah.
What that does is it changes the torque generations in your body. So by having your chest more forward, it pushes your hips backwards more, which means there's a longer moment arm, which means, I mean, if anyone's, you know, loosened up a bolt, when you take a wrench, if you have a longer wrench versus a shorter wrench, it's much easier with a longer wrench because that lever is much longer.
Yeah.
Same thing goes with a squat. You're using a longer lever at your hip joint. Your hips are the strongest muscles of your body. So on paper, most people can squat more with a low bar stance because they're generating more torque at the hip joint. Now, again, that's saying that they're extremely comfortable with that low bar squat technique. If you're not comfortable in it and you feel stronger with the high bar, you're obviously going to squat more weight with the high bar. So, you know, it's always about what you feel most comfortable with. Now, let's talk about the shoes, because you brought that up. What a weightlifting shoe does is it gives you an added, you know, depending on what type of shoe you're using, most weightlifting shoes are about a 20 to 30 millimeter heel drop. So think about your natural running shoe. You've got that cushion there. Well, that's about a 13, 14 millimeter heel drop. So a weightlifting shoe is much higher than your regular running shoe, which gives you a little assistance in ankle mobility. So if you regularly, when you squat with flat sole shoes or barefoot, allow your knee to maybe go forward an inch past your foot, that allows you to keep your chest to a certain point upright. Well, with the weightlifting shoe, your knee can now move maybe 2 inches past your toe, which means you can squat even deeper and your chest can remain even more upright. So depending on the sport you're choosing, sort of gives you what you need with your shoe wear. So for example, as a weightlifter, if you're catching a snatch or a clean, your goal to be the most efficient is to catch that bar as low as possible with the most upright chest position. Because if you catch a snatch and your chest is really far forward, it's pretty easy for that bar to roll forward, right? You know, and if you can catch that snatch and clean that much deeper, that means that you can lift that much more weight because you don't have to get under, you know, or you're able to get under that much more weight. So that's why every single weightlifter uses that weightlifting shoe, because it allows them to be more efficient. Now, let's talk about powerlifting. Not many powerlifters use the full weightlifting shoe for a couple reasons. First, they don't have to go as low as a weightlifter when they catch the bar. According to, you know, powerlifting rules, you only have to squat to a point where your hip crease is below the tops of your knees for a passing squat. So you have to think about that. Also, you have to change torque generation. By wearing a weightlifting shoe, it's changing up and balancing out those torque generations between your knee and hip a little bit more by giving a little bit more help to the knees. So, you know, depending on the sport you choose, I see some powerlifters that will use a weightlifting shoe. Some will use, they have a half size heel. And if you feel more comfortable in that, there's nothing wrong with it. I know most powerlifters that I see will use a flat sole shoe, like a Chuck Taylor or a wrestling shoe. Just sort of gives them that firm foundation, a little bit of assistance with keeping an arch in their foot, you know, compared to a barefoot squat, but it doesn't give them the assistance of the knee over toe, which, depending on their squat that they're choosing, they may not need that at all. They just need something hard to push off of to give them that assistance.
And versus a low bar, high bar setup, if you're a low bar squatter, would flats be more likely, or a heel, or does that even matter?
It's really all about, you know, you individually feeling as comfortable as possible. I will say most people that I've seen that squat low bar don't use a weightlifting shoe Some people do, however. It's really all about, what you feel most comfortable in. And if you want to, try out the weightlifting shoes. See how it feels. If you don't like it, you don't need to use it. It's really going to be a personal feel. But I think most people across the board that are using a low bar squat are probably also going to be using a flat sole shoe. They feel most comfortable in that. They don't need that added ankle mobility assistance with the weightlifting shoe. So I think it's really about what you feel most comfortable with.
Yeah, because I find when I do a low bar, if I do like heels, low bar already pitches forward. Then with heels, it's really starts getting a little too much. Right?
Exactly. Yeah. It's all about staying balanced, and the shoe wear is a huge deal. And a lot of people don't think about it, but like I said, your foot sets the foundation for the rest of your body. So if you're in the wrong shoe wear for what type of lift you're doing, it can really make dramatic changes.
Would you say, in terms of picking whether or not someone should use a shoe, would forward tilt be something you're looking for? We're like, okay, you're too far forward. The hips are getting too high. Yeah.
Yeah, for sure. And that's where, it's really important to try different things out and then analyze your squat. So I always say, look at your squat from the side and see where your bar is tracking. If you're using the wrong shoe and it's maybe not right for your body, that bar is going to pitch forward. That bar should always track right over the middle of your foot. That means that your body's in balance and able of producing efficient force and power. So if you're using the wrong shoe, your technique is off because of it, that bar is going to be all over the place. So you really want to find the shoe that allows you to produce the most efficient force.
Another thing, so when you talk to Olympic lifters, they talk about the low bar almost like it's like a bastardized version of the squat. You don't do low bar. You know what I mean?
Yeah.
Like you don't do. And is it like in terms of if you're an athlete, let's say you're not just a power lifter, but if you're an athlete just trying to get stronger, bigger, faster, stronger, etc. Is there a right and wrong way to do it? Like, should you be leaning more towards one or the other, or does it?
Yeah. The squat is the squat, and if you want to squat low bar, there's nothing wrong with it. The reason why Olympic weightlifters squat high bar is because it carries over to efficient clean and snatch strength movements. Because if you think about it, when you catch a clean, you have to be very upright. When you catch a snatch, you have to be very upright. So you want to strengthen the positions necessary to catch the bar in those very upright positions. If you squatted low bar all the time, you wouldn't be strengthening your body to catch that clean in a very upright position. So that's why Olympic lifters use the high bar back squat compared to a low bar back squat. Now let's say you're a baseball player, a basketball player. You can squat low bar. There's nothing wrong with it. I really think the only sport that I would say I would probably lean towards only squatting high bar would be the Olympic weightlifters, because we're trying to look for efficient carryover to your lifts of the snatch and the clean and jerk. But for every other sport, the training that you're doing in the weight room is to get as strong as possible. So really using whatever lift you feel most comfortable with. And for some lifters, depending on their anatomy, they're going to feel awesome with the low bar back squat. There's nothing wrong with it.
It's funny. So I'm glad you said that, because I training with like some hockey players, etc. So they watch, everyone watches online, Instagram, YouTube, etc. And they'll be watching guys who are like Olympic weightlifters, and they'll be fielding questions, and someone will ask them about like a low bar, and with low bar, no, we don't do low bar. That's blah blah blah. And so these other athletes who aren't training for Olympic lifting take it as gospel and be like, no. So I'm talking to these hockey players like, no, we don't low bar. That's powerlifting talk. It's like, no, man, it's not. Like, this dude is an Olympic lifter, so it doesn't work for him, but there's no reason why you should, right? So I
would even think for hockey, it would be even more apparent. If you think about the position a hockey player in is, what they're in whenever a lot of power, they're in a very forward chest position. I would think low bar would actually have more carryover to their sport than any other sport.
And in your opinion, so is the squat probably, if you had to pick one exercise, okay, you can only pick one for every sport, whether it's Winter Olympics, Summer Olympics, what would be the one exercise you would pick for an athlete to do if they could only have one?
For an athlete to do, I mean, that's a tough, because I think the squat sets the foundation for so many other things. I do like the full clean, and the reason is because it does include a variation of the squat. When you catch that clean, you're in a front squat position. You have to come up out of it. The thing I like about the full power clean is it's going from a low position. You have to generate a ton of force. You then have to be able to move quickly into another position, generate a lot of force and stability, and get out of it, which that's what being an athlete is about.
Yeah.
You know, as a squat, when you think of the squat and you're squatting a lot of weight, it's not an extremely powerful movement compared to the other lifts. It's a very strong movement where you're moving a ton of weight. But as an athlete, it's not just about being strong. If you were just really strong in the sport of football, you would be a pretty horrible lineman. You know what I'm saying? You have to be extremely fast to be able to keep that DN from moving around you. Mm-hmm. So, you know, having that speed and coordination component to the lift makes it an athletic movement. So that's why I say the squat is something every single person should do. I'm not, you know, I'm talking about your 10-year-old, he needs to be learning how to squat properly. Mm-hmm. Grandpa needs to be squatting if he wants to be able to keep up with his grandkids and to be able to keep away that knee replacement in that back pain that he's probably going to have. You know what I'm saying?
Yeah.
But if we're talking about the pure athlete, if there's one movement I would do, it'd probably be the full clean.
Oh, no kidding. Full clean university coming out. And I guess you would kind of use both of those in conjunction because the squat helps the clean and vice versa.
Exactly. Yeah. Exactly. The squat sets the foundation for many other athletic movements you can do. So if you can't squat, there's no way that you can start a clean. So for example, if I have an athlete that's coming to me for the first time and I want to teach them how to clean, I'm first going to ask them to show me a good front squat. Mm-hmm. Because if they can't front squat, there's no way they can do the clean because the front squat sets the foundation for the clean. Mm-hmm. It's a more powerful, it's a more coordinated movement. So the same thing goes for a lot of athletes that are learning the Olympic movements for the first time. If you're trying to do a snatch, you need to first show me a good overhead squat. You need to show me from there a snatch balance. You know, we don't just go to the snatch and just start from there. You have to set the foundation for your more powerful movements, the movements that are coordinated, that are eventually going to set the movement foundation for the more athletic, powerful, fast movements. You have to be able to first show me good coordination with that.
And when you say power, so we're talking, so there's force and there's power, right?
Mm-hmm.
So force is like the power lifts. It's kind of like weirdly named. And then power would be the quick, athletic, speed, explosive.
That is the funny thing about the word powerlifting is that it doesn't necessarily mean it's a powerful movement. Yes, there's a lot of weight being lifted, but the actual scientific term power has a speed component.
Yeah.
So it's the amount of weight that you're moving, how quickly, that's the amount of power you have. So that's why when you look at the Olympic lifts, they're very powerful because you're moving a lot of weight really quickly. I know when there were a number of scientists that were basically looking and analyzing different movements that were happening during the Olympics. I believe it was, I can't remember exactly, it was a young female weightlifter. Her snatch apparently was the most powerful movement in the Olympics that year, and this is a number of years ago. But it was moving so much weight so fast, it was more powerful than a high jump, more powerful than the long jump. But basically, you know, the amount of force that they're, you know, driving in one split second, that's power.
And so in terms of what's the relation in terms of, you know, building force, generating, your body can generate enough force to, because to move 300 pounds that quickly over your head, you got to be strong. You have to be strong. You know, so it's kind of like, I mean, I've had these conversations with training some hockey players that I work with, and I'm sure people watching the same questions. So there's this balance where, okay, you could do cleans and be quick with a plate aside, but you do that, you're not generating a heck of a lot of power. It's not a lot of weight. You're moving it quickly, and then conversely, if you had 300 pounds, like you were saying, the amount of weight that fast covering that distance, more power outage. So then what's the kind of the relationship between like squatting, building up your force, getting as strong as possible, and then transferring it over? Like what in terms of, you know what I mean? Like,
yeah, and that's why as weightlifters, we use the squat as a very supplemental exercise to build that strength, because it's not just doing cleans. If you don't have that strength, there's only so much you can do with just the clean alone to be able to build that strength. So, for example, there's this thing called the force time curve where you have, you know, if you're doing 30% of your 1 rep max, you can lift it really, really fast. And then if you're doing 90% of your max, you can only lift it so fast. So for weightlifters, you spend a majority of your time lifting and developing that power in like the 70 to 90% range. You're only, developing your power when you're lifting efficiently in that zone. You don't spend a lot, all your time lifting 95 to 100%. Does that make sense?
Yeah.
So to develop that power, you need to be able to lift in that zone where you're moving a certain amount of weight as fast as possible, and develops a lot of speed. So as a weightlifter, then you take that after you're doing your cleans, and then you go and you develop that pure strength with the squat, with pulls from the floor, different things like that, so that your body's gaining strength and then transferring it with your Olympic lifts into the power that you're generating for your full lifts.
So for the general athlete, what would that kind of look like in terms of priming? And we're just talking in general sense. We'll say, I know different sports, things might change, sports specific, but in a general sense, if you want to make someone stronger and faster, what would the programming look like? Like, how often would they squat a week? How often would they do these power cleans, would you say?
Yeah, that's a great question. It's really based on the individual. There's a number of different factors. There's movement. So basically, how well do they move? Their movement age. Let's say you have an athlete who moves horrible. I don't care if they're 10 years old, if they're 30 years old, 50 years old. If they move like crap, they're not going to be able to handle a lot of volume.
Yeah.
So that's a big one. Training age. If they've been training for 1 year versus training for 20 years, that's going to be totally different in how much volume, how much intensity they can handle. Those are a number of different factors. So as far as, their programming, you can squat every single day. Travis Mash from Mash Elite Performance, he has a squat everyday program. There's a number of other people out there. Corey Gregory has a squat everyday program. A lot of people can handle that, but they've been able to show good technique and a good amount of movement quality over a long-term training period to be able to handle that amount of force. Let's just say you have your high school athlete. They're probably not going to be able to squat every single day because they haven't built up the ability to show that good of technique and the endurance to do it that often. For most people to start 2 to 3 days a week. That's a good amount for squatting, and then I would do, your power cleans or whatever on, consecutive days after that. And you can even do them in the same workout. The big thing that I'm trying to get across for most people is you have to individualize your programming. The thing I hate the most is when people just go online, they haphazardly pick a program, and they send it out to every single one of their athletes. Because some athletes will excel on that. Some athletes, it's going to be way too much. Some athletes, it's going to be not enough. So as a coach, it's so important to be able to individualize the type of training as far as your intensity, your volume, the type of exercise they're doing. Some athletes, they need and will excel more with that more powerful movement of the cleans more often, whereas some athletes are going to be too much for their body. So if you don't individualize the programming, you're never going to get as much out of that athlete as possible.
Especially if probably, you got somebody doing things like snatch and stuff that are a lot of coordination. This guy is training to be football player, basketball player, hockey player, whatever, and you got him focusing so much on this technique for this one movement, and he can focus so much time and effort when it's like, man, I really want to do is be a better athlete in my sport. Is there something else I could do that will give me just as much benefit and not so much time and energy focusing on this one particular movement?
Exactly. So another thing like that, the snatch is a very, very technical movement. It takes a lot of reps and time in the gym to be able to perfect your snatch. If you're a football player, my goal is to get you as strong, as fast, as powerful as possible. So will I maybe get a little bit more out of him by just doing a clean, maybe clean and jerks, but do I necessarily need him to do snatch? Well, if he's got a lot of time in the gym, maybe. But if he's only got an hour a couple times a week to be able to train in the weight room, I need to be as efficient as possible in what I'm programming for him to get the most out of it, because the goal of that athlete is so important in how you program. For a weightlifter, for sure, they have to be able to spend a lot of time in the gym perfecting their technique. As a football player, as a basketball player, baseball player, the technique of the snatch is not as important. In their end goal is just to become a better athlete for their chosen sport.
Now, in terms of powerlifters, is there should they be doing, would there be benefit doing cleans, power cleans, and some of these Olympic movements to increase power outage that would carry over to the power lifts? or no? What do you think? What are your thoughts on that?
I mean, to a point. I mean, I think definitely having that speed work is extremely important. Again, like I talked about, working in that range where you're not doing 90, 95%, you're going to be able to build power, the amount of force that you can develop really, really quickly. So, you know, possibly doing cleans here and there would be huge. Does a power lifter whose end goal is to be able to maximize their potential in the deadlift, the squat, the bench, is focusing 2 hours every single day on snatch work a good idea? No. Possibly adding in some power cleans, is that a bad idea? Not, you know, I think it might be a good supplement to work. But in the end, again, with your programming, what's the end goal? You have to understand and prioritize your movements. Your end goal is to be able to perfect your lifts on platforms. So you're going to have your squat, your deadlift, and your bench as your main priorities. And then anything after that is just filler based on what you need. What, you know, if you're, let's say you're someone who struggles a lot with the deadlift, and maybe it's not just necessarily strength, but you want to work on your power in that. Well, there's a number of different things that athletes do to develop that power, whether that's band work, whether that's chains, that's going to change, you know, modify the force at certain parts of the lift you can do. You know, you can do pulls from a deficit, different things like that. You know, adding in some cleans may be something that you feel helps you feel more powerful in the deadlift. I don't think there's a right or wrong answer. It's probably not to the extent as many Olympic weightlifters would think, but in the end, it's all about what are your priorities and what do you feel you need to be able to, you know, generate the best, you know, performance when it comes down to the meet.
That's interesting you brought up the deadlift. And if we could touch up on the deadlift a little bit. What are some of the things that you find in terms of people do wrong with the deadlift? Like, for instance, a lot of guys, if you use the same overhand, and I use the same overhand for a long time with my top sets just because I feel like I get really tight on that side. I get tighter than if I try to hook grip, etc. But does it create imbalances? And also maybe touch up on the sumo and conventional differences.
Yeah, I will say I haven't seen a number of powerlifters who have developed a lot of asymmetries with that side to side because of their grip. I definitely see how it could be possible. Again, why it's so important to also add in single arm, single leg things into your workout so that you are making sure that your body's balanced out a little bit. But then again, sometimes really elite athletes develop asymmetries that are natural to their sport. So, for example, if I see a baseball player, it's normal sometimes, especially if they're a pitcher, to be sort of lopsided in how much motion they have on one side. They may have a little bit more lat development on one side because that's something that they have developed as a part of becoming an elite athlete in their sport. So, me looking at them at the first time, that asymmetry may not be necessarily something that I need to change. You know, that may be something that has allowed them to develop into the athlete they are. So just because an athlete is not symmetrical doesn't mean I need to change that to make them symmetrical. There's a point, you know, if they're completely lopsided, that's going to set them up for walking around like crazy. That's going to set them up for possible injury. Yeah. But small asymmetries are sometimes normal in certain sports. So I mean that's something to think about as well.
And in terms of a sumo in conventional, if you're dealing with an athlete, for anybody watching, any coaches watching, and they're working with an athlete, what are some of the things that you do in terms of when you make the decision, you know what, maybe you're a sumo deadlifter, maybe you're conventional? Because I say this because oftentimes, whenever someone starts, they start conventional. And when they start going into sumo, automatically, it's very rare, it's like, I love sumo, I'm going to start pulling sumo from here on out. There's a transition. And it takes a bit of work. Same with like high bar to low bar. There's a transition phase. Then things start clicking. How do you really know when it's like, you know, it's not working? Abandon it. Go back to conventional. How do you? Are there people who say, are there ways of looking at levers and where people draw their strength from their legs or their back, etc., that help you decide? You know what? You might want to give a little thought into the sumo and put some work into it based off your levers and strengths. Is there stuff like that?
Yeah, that's a great question. And now I will, you know, preface it with this. The powerlifting aspect of the deadlift with the sumo and conventional is something that's a little bit out of my expertise level because of how much time I've spent in Olympic weightlifting. But I will say as a coach, depending on, let's talk about, you know, if we even bring it into Olympic weightlifting, some people will change up their stance as far as having a narrow stance and a wide stance as far as their setup to pull for a snatch or clean. Same sort of thing applies. it really is going to come down to feeling comfortable, how much power you're able to generate. And really, that's where having a coach is so important, because they're going to be able to give you that non-biased feedback. A lot of times, people will sort of get in their heads when it comes to their lifting, and they won't be able to really step back and have some self-actualization to be like, hey, man, you may feel like you're doing really well here, but it's not working.
It's ugly. You know? It's ugly.
Every single lifter, no matter how elite you are, you need that coach that's going to be able to tell you straight, you need to change this up because this is not working right for you. And no matter what it is, whether it's sumo versus conventional or toe angle or, your back position, having that other person that can, give you that non-biased view and tell you straight, you need to change this up, that's extremely important.
And you were just saying toe angle. I'll let you go in 1 second, Randy, but just because you said it, I want to touch upon toe angle for squatting. Is there right and wrong? And same with hand placement. And it might change for high bar, low bar. But is there a right and wrong for that?
No, that's a great question. And this is where a lot of people, I think, have questions because they hear a lot of different things on the internet. Toes forward, toes angled out. What do you believe? So here's my straight answer with that. When I screen the squat the first time, I want to screen with your toes relatively straight forward. And what I mean by that is about a 5 to 7 degree of toe out angle. That's anatomically straightforward. Your ankle joint is not necessarily a completely straightforward joint. So a normal toe out angle when you are in anatomical neutral position is a very slight 5 to 7 degree toe out angle. So when I screen the squat, I want to see you perform it in that position. And what that tells me is it illuminates problems that you may have in mobility, stability, movement coordination. So that's why I screen straight forward. However, when it comes time to barbell training, turning the toes out slightly can do a couple things. First, it's going to change up. If you have stiffness in your body, it's going to allow you to work around it a little bit. For example, if you have really restricted ankles, turning your toes out allows you to sort of bypass that ankle stiffness and maybe squat a little bit deeper with your chest a little bit more upright. Now, that doesn't negate the fact that you have ankle stiffness and you need to work on that. But when it comes time to train, my goal is not to necessarily work on those weaknesses, but to improve on your current capabilities.
Well said.
When it comes time to barbell train, I want to improve your strength and improve your current capabilities. So turn those toes out slightly is a good thing. It's also going to engage for some people, depending on your stance, with your adductors a little bit. So your adductor magnus, the big muscle that's on the inside, it's also been called your fourth hamstring because it can help with hip extension, which is driving up out of the hole. So for some people, turning those toes out slightly and having a little bit wider stance can allow you to engage those adductors just a little bit more. So it's sort of a two-story kind of thing is you need to have, in my opinion, the ability to squat, for most people, toes relatively straightforward. And an inability to do so shows me things that we need to work on. However, when it comes time to perform, turning the toes out slightly, I really feel it's all about finding the squat stance that you are most comfortable with and feel the strongest with. Now, when I say slightly, I'm talking maximum up to 30 degrees. I see a lot of people that get there and they turn their toes out really far. I really feel like when you do that, you're changing your hip, basically torque capability, and you're basically allowing your body to move into the pattern of least resistance, which is allowing your body to get into better positions, but it's not necessarily the best for your body. You could be better is what I'm trying to say.
Okay. And in terms of foot placement in and out, is there right and wrong for that, or is there something like, because some people are stronger in the legs, are they closer in, or is that more just mobility?
And is that mobility, or is it genetics too? How much does genetics play in that part?
Yeah, great question. It's really going to be both, because here's the thing: is you're going to have two different things that determine your stance, and that's soft tissue, which is going to be like your fascial layers, your muscle, how stiff those are, and then you also have your hip mobility in terms of your anatomy. So if most people, I've looked at a skeleton before, you have your acetabulum, which is your hip socket, and then your femur that fits in. Now, when you look at an anatomy book, everyone is basically the same. Well, that's not the case. Some people have really, really deep hip sockets. Some people have really shallow hip sockets. Some people have a femur that is angled a little forward. Some people, it's angled back a little bit. All of that is going to change how your body feels comfortable. It's called anteversion or retroversion as terms of, where your angle of your femur is actually fitting. And that's going to change up your squat stance. So your hip anatomy is a huge part in that. For example, some people, because they have a very shallow hip socket, they're going to be able to squat extremely deep because their femur never really comes in contact with the front of their acetabulum as they go down. That's why some people, they're able to squat as progress and have a perfect upright chest position. While there's other people, if they have a very deep hip socket, their femur is going to hit the front of their acetabulum sooner on the way down during their descent. What that means is two things. A, they're going to have that pinching sensation in the front, which is called FAI, femoral acetabular impingement, or their hip is just going to completely rotate under, which is what most people call butt wink.
Yes,
so
that's what people say. You got tight hamstrings. But sometimes it's not the hamstrings.
It's not hamstrings at all. That's one of the biggest things I try to get across to people. Tight hamstrings do not cause butt wink. And it's because the hamstrings are a biarticulate muscle, which means it crosses the hip joint, but it also crosses the knee joint. What that means is that your hamstrings don't change in length during the squat. They shorten at one point and they lengthen at another. So they're relatively the same length the whole time, which means that it couldn't cause butt wink, because butt wink is your hips are here, and then as you squat, it is pulled under. So if your hamstrings are keeping the same length the whole time, it's not causing that excessive movement in the pelvis. It's either one of two things. First is the anatomy, which is what I talked about. Your femur comes in contact with the front of the acetabulum or the hip socket. It can't go any farther forward, and if your body doesn't want to have that pinching pain, the only other option it has is to rotate excessively forward. Now, we can't change that.
Yeah.
Sort of surgery, Second thing would be your ankle mobility. Your ankles, like we talked about before, allow your knees to translate further forward over your toes. So if your ankles are stiff, eventually your knees are going to hit a wall. They can't go further anymore. So if your body wants to continue squatting deeper, your pelvis is going to be pulled under your body. So if you want to improve on ankle mobility, this is improve on your butt wink, there's one modifiable factor, which is ankle mobility. So you can test your ankles, and the more your knees can translate further forward over your toes, the more your pelvis and low back can keep that alignment on the way down without that pulling under. So because as soon as your pelvis goes, your low back's going to round eventually, which is going to put your body in a flex position. And that's where some people are like, is butt wink the worst thing in the world? Well, it depends on how bad it is. Mm-hmm. If it's just a little bit at the very bottom of your squat, it's not, in my opinion, as big of a deal as as many people make it out to be. Some people, they see a video and they're like, "Oh, that's butt wink."
You don't know what you're doing.
Worst thing in the world.
This dude could be like a world-class powerlifter, and it's like he's butt winking. He doesn't know what he's doing. There's nothing he can do about it. Sometimes it's the way it is for him.
Yeah, I threw up a video on YouTube a couple months ago, and in that I showed an example of an Olympic weightlifter catching a snatch, and technically there's butt wink at the very bottom of his snatch. I don't think he's, going to be blowing a disc out anytime soon.
Yeah.
However, then you have those people that show a lot of excessive butt wink, and what that does is because it puts your low back in such a flex position, eventually, theoretically, over time, because you have so much force going down through your spine, it creates a position that eventually could cause, a disc to force out the back. So that's where that disc herniation theoretically could happen. And it's not all at once. This is over many reps, in many sets, over many months. But because you put yourself into a bad position, eventually bad things can happen. Now, that occurs with everything. That's why when people look at their knees wavering in, are they going to blow an ACL? Usually with weightlifting, no. It's something that eventually, though, because you're moving a certain way that's not mechanically efficient, and that knee is not directly over your toes, over many reps, over many sets, eventually you're going to be putting such forces on your knees that are going to cause generalized knee pain, whether that's patellofemoral, which is a very vague term, tendinitis here and there. You're going to develop issues that your body can't handle. So eventually you're going to cause yourself pain. So that's why when I talk about the squat, I harp on technique so much, whether we're talking about butt wink, whether we're talking about the position of your knees. It's because, can you move a lot of weight poorly? Sure. My goal, though, isn't to just help you squat a lot of weight, but I want to see how much you can squat with good technique, because in the end, I want you to be safe and healthy doing it. I don't want you to develop knee pain 20 years down the road. I want you to be able to have your knees and not have a total knee replacement, because that's who I see. I see athletes that are injured all the time as a physical therapist, and the one reason is because their technique in whatever they're doing is subpar. It's not efficient, and the body eventually breaks down. So a lot of times people look at these Olympic weightlifters, these powerlifters who are elite in every sense of the word, and they don't move extremely efficiently. Now, most do, but some don't. And a lot of people point to this person, they go, hey, Klokov moved this way, he's fine. I don't care. He's a freaking elite athlete. He can't get away with it. Yeah. You know, a lot of people, the whole knees first thing. They say, well, so-and-so, Ray Williams squatted 1,000 pounds and his knees moved first. Awesome. That's amazing for him. 99% of people can't squat that way, or else they'll develop,
It's interesting you said that, because some people are saying now, I remember before it was hip hinge, start going, now it's some people saying, no, go knees first.
Yeah.
And what is really, how should it be? What do you think?
Here's the deal. It's a good squat starts from the hips. The amount of that hip hinge is going to be based on the technique you're performing and your anatomy. If you're performing a low bar back squat, you're going to have a more pronounced hip hinge than someone performing a front squat. Because if you hip hinge that much with a front squat, you're just going to dump the bar forward. Yeah. Pretty simple. Yeah. But when I say start from the hips, I don't mean the knees don't move at all. Mm-hmm. I'm talking about the hips are going to move, the knees are going to bend a little bit, they're just not going to jam forward at the start. What happens is that when our knees move forward excessively at the very start of the lift, it puts a lot of shear force on the knee joint. Mm-hmm. Now, at the very start of the squat, there's not a ton of compressive forces yet on the knee. The deeper you squat, the more compressive forces there are. And what happens is that the deeper you squat, because there's more compressive forces, it balances out the shear force that is put on the knee, which shear force is side to side. So what happens is that it creates a protective mechanism so that when you're in the bottom of the squat, if your knees are really far forward, that's okay. Because there's so much compressive forces, your knee's in a safe position. Mm-hmm. But if you jam your knees forward at the very start of the lift, there's not a ton of compressive forces relatively on the knee yet, but you have a lot of shear force. Mm. So you're putting some harmful forces on your knee that eventually could lead to the development of pain. Now, when I say, you need to always start your squat with your hips, the reason is because I have seen so many athletes who have developed knee pain because they start with their knees. It's an eye-opener. A lot of people, they say, well, so-and-so starts their lift with their knees. That's fine for that person. Yeah. That's the 1% that can do it and get away with it. The 99% of people out there will develop knee pain because they're overloading their knee joint and their tissues cannot handle that. So I don't preach to the 1% of people out there that can do it. I'm preaching and trying to empower and teach the 99% of people that if they move that way, will develop pain. And I'm trying to help you do so and squat pain-free and lift to your max potential. And the only way to do that is to move from the hip slightly first and then squat straight down.
So what are some of the things you would give recommendations to for new lifters? Like, what are some of the things just starting off, whether it's Olympic or powerlifting, what are some of the things you would say for squatting is good?
I mean, the first thing, if you're a new lifter, you have to go find a coach. I don't care if it's the hardest thing in the world. You don't have anyone near you. Get online, find an online coach that can view your videos. That's so important, is to get someone else who has been there, who can help you fix your technique, because just watching videos alone, it's so tough to analyze. Unless you have been in the game for a long time, it's hard to analyze yourself when you don't know what you don't know. So finding a good coach is crucial. But then it's really about, finding the small cues to keep yourself safe. Starting with the hips first, keeping your knees in line, keeping the bar. If you're a new lifter, videotape yourself as much as possible and watch yourself to, take a step back and see what does your technique look like. View yourself from the side. Is the bar tracking over the middle of your foot, or is it tracking forward, like we see a lot of people have a problem with? So really, video analysis is huge. And then finding a coach that can help you, whether that's online, in person is obviously the best in my opinion, because they're going to help you be able to make those, in person, on time cues. So that would probably be my best suggestion, is finding someone that can help you early on, understand the problems you have and fix your technique.
Are there other things, like we just talked about, butt wink and knees first. Are there a couple other
Shoulder dips.
things you want to dispel that people seem to be assuming? Any assumptions about the squat that you hear common, like, I hate when people say butt wink is this, knees first. Is there anything else that you think we should touch up on that you hear that you think is wrong?
Yeah, I mean, the biggest thing I think is the knee should not go past the toes in the squat. That's a huge one.
Yeah.
And that's completely false. It's about when and not if the knees go forward in the squat. If the knees go forward in the squat at the very end, I mean, if you see any videos of Olympic weightlifters, their knees are very far forward past their toes, but they have to be able to catch the squat with the very upright chest. It's a complete myth that that's a bad thing for your knees. Olympic weightlifters don't have more arthritis in their knees compared to everyday population, but it's because they're performing those lifts with great technique, and they're not allowing their knees to jam forward at the start of their squat, but only at the very bottom. That's a big one. That deep squatting causes arthritis in their knees. I think there's a meme out there, and it's like squatting's not bad for your knees. Squatting with bad technique is bad for your knees, or something like that. I mean, it's so true. Squatting is the most safe thing for your knees and creates a protective mechanism that's going to limit the potential of arthritis developing in your knees. But it's about how well you move first. If you move like crap, yeah, your body's going to break down because you're putting an external load on your body. So it's going to break down even faster if you squat with crap technique. If you squat with good technique, you focus on the movement first, you're using correct loads, you're not overloading your body when it's not ready for it, your body can sustain those forces and do so healthily and keep your body safe for a long time. You shouldn't have to resort to a knee replacement by 70. That shouldn't be the norm. You know, you should be able to keep your knees for the rest of your life. You shouldn't have back pain as a common thing by the age of 50, you know? But if it's because we've sort of subjected ourselves to the thought that, well, I'm over 30, I'm not really a conventional athlete anymore, I don't need to be pushing big weight, I don't need to be in the weight room 4 days a week anymore, I guess I'll just sort of cut back and maybe I'll just lift light. That's the one thing I hate the most, is that people go, well, I'm not competing anymore, I'm not really going to be pushing, I don't think I need to go heavy anymore. The stronger you are, the more your body can handle the loads of everyday life. You know, if you think about this, if you have two people, person A, person B, we're talking about curls, right? Let's say person A can curl 100 pounds. Person B can curl 20 pounds. That's their 1 rep max curl. Well, if I give both of those people a 5-pound weight and I say, I want you to curl just all day long, right? Who's going to break down first?
Yeah, no
the person
question.
with, that can only curl 20 pounds. Their muscle's going to have tendonitis eventually. They're going to get rhabdo in one arm or some crap like that, right? Because their body can't handle those forces. Well, if we talk about the squat, the deadlift, anything powerlifting, right? Those muscles are your muscles that you use in your everyday life. Whether you're out in the garage lifting a box, whether you're, just going about your day walking a mile, right? The stronger your muscles are, the more your body can handle the forces of everyday life. So the squat is something that you don't just do as an athlete. It's something you do for life. And if you're 50 years old and can squat more than every other 50-year-old, it means that you have the potential to handle so many more forces to where when you go out in the garage and you're lifting a heavy box, that's nothing to you. That's 10% of your max. So it's going to be easy for you to be able to handle those forces, which means your body's going to stay stronger and healthier for much longer in your life. And really, that's what it's all about, right?
It's interesting you were just saying, so the higher up your 1 rep max is, and it's true, relative less weight becomes, you could do for volume a lot easier. It takes a lot less out of you. A lot of people think if you train and keep pushing your 1 rep max, when you go to do, let's say you could squat 600 pounds, but you probably can't do 315 for very much. Well, that guy who squats 600 pounds, 315 for him probably is toy weight, right?
Exactly.
So he's going to rep that out. And that's how the nervous system,
How much does shoulder mobility affect your squat?
Yeah, I mean, shoulder's a big thing. A lot of times, I see a lot of people, especially powerlifters, they'll say they'll develop wrist pain or elbow pain in the squat. And a lot of times it's because they can't get their arm back into a good position. Yeah. So a lot of times, you think about this, right? If you're a powerlifter, you're spending time on your 3 main lifts. Well, a lot of times if you're doing a lot of benching, right, you're going to develop a lot of stiffness in your pecs, which is going to limit your ability to get your arm back into a good position to be able to grab that bar. Let's say you're having a fairly narrow grip on your bar. You need a good amount of shoulder mobility to be able to get into that position. And if you don't, that means that you're going to have certain forces going through your elbow and wrist to be able to make up for that. So you need to be able to balance that shoulder mobility to allow your body to get into better positions. Now, it's really depending on the type of athlete, because some athletes are very mobile in their shoulders, almost too mobile. So I don't need to be doing a ton of stretching with them. So it's really, that's why I don't like making a very, very generalized statements when it comes to upper body mobility, because a lot of people have a crazy amount of shoulder mobility. And if you increase and try to stretch an already mobile shoulder, you run into a lot of problems.
And you know what? Yeah, that's kind of like the feet, where the placement of the hands can help alleviate stress on the shoulder and wrist as well. Depending on, like, you might want it closer, but if you can't get closer, your hands go a little further out. Is that kind of like to do with the hand placement?
Exactly, yeah. So what we find is that a lot of people that are very stiff in their shoulders, they're like, oh yeah, I naturally have to have a really wide grip. Well, I mean, is it really wide grip a compensation for stiff shoulders? Or do you really feel more stable out there? Some people, they really enjoy having a wide wide grip on the bar. They feel more stable. That's completely fine. There's nothing wrong with it. However, if you think about it, if you're able to bring your elbows in a little bit closer, you're pulling your shoulder blades together, which is going to, in my opinion, create a better platform for the bar to sit on. So I like getting as close. Obviously, you don't want to be right next to your shoulder, but a little bit closer in my opinion, is able to give you a little bit better stiffness in your upper back and create a better platform for the bar versus someone who has a really, really wide grip.
Does having like one tight shoulder, like, will you see more of a dip in the squat? Like when they come down, like dipping to the left or dip to the right at the bottom?
Helicopter a little bit.
Yeah, it could be due to shoulder mobility. I feel like a lot of times what you'll find is that one shoulder will like sort of pull under the bar, which is then going to change their entire position. So yeah, I definitely, again, just like the lower body, we're going to look for upper body side-to-side differences, because if you have an extremely tight shoulder and extremely weak, mobile shoulder, that's going to change how you're setting up on the bar, which is then going to change your entire movement. If you're off even by a couple percentages on one side versus the other, how that weight is being handled, it's going to affect the entire lift. With, during a light 70%, it may not affect you. But if you're going for a 1 rep max, if you're off a little bit on side to side, you're not going to be lifting as efficiently as possible. So that's where cleaning up those side to side differences, it's really important, not necessarily for the small training that you're doing where you're, not training to your max, but when it's time to compete, you need to be moving as efficiently as possible. So clearing those up will allow you to produce the most efficient force and power and have your body handle it without developing pain.
So you wrote a book. Do you want to take the time here right now to talk a little bit about that?
Yeah, you know what? Like, you're obviously you know your stuff. I think a lot of people wouldn't mind picking this book up. Where would they get it if they got a hold of this book? And what's it about?
Yes, so the book is called The Squat Bible, The Ultimate Guide to Mastering the Squat and Finding Your True Strength. It's available on Amazon.com, all over the world. Basically, the premise is that every single person should be able to perform a good squat, and I want to be able to help you find how to do that yourself. Now, the big thing that sets this book apart, in my opinion, based on other ones that are out there, is I help you screen your body to find out what specific weak links you have that you can then fix. So if you have ankle stiffness, how do you screen for it? Well, here you go. Here's a test you can perform. Here's how you can screen for your ankle mobility. Based on what you find, here's 3 things to help you improve that ankle mobility and how it's going to affect your squat. Because the thing I don't want to do is I'm not here to throw 1,000 corrective exercises at you that you have no idea how to, why you're using them. Every single thing you do in the gym should have a why. You should know how each single exercise that you perform fits into fixing your squat. Because if you have 20 minutes in the gym to perform some corrective exercises, I want you to be efficient and effective with what you choose. So I'm going to give you the things that your body needs. Because if I have 10 people lined up in a gym, I shouldn't see all 10 people performing banded joint mobilizations of their hip. Because maybe only 2 people need to do that. You know what I'm saying?
Yeah.
So that was the big thing that I wrote the book, was to help every single person find out exactly what they need. And then I give you a few things to be able to perfect that. I'm not here to give you 1,000 corrective exercises. I'm here to give you the 3 or 4 best ones for exactly what your body needs so that you can perfect your movement quality and then perform. Because I want you to lift. I just want you to do that with good technique first. So it's all about fixing that movement quality and then lifting big weights. So we go over technique, which isn't anything new. I try to explain things as simply as possible. So that's been a journey for me, is, being able to take sort of the writing style that I used to have when I was going through my doctorate and writing for the nerds and the publications that are out there, the professional journals, and then taking it and writing clearly. So every single person, no matter what type of educational background you have, can clearly understand what I'm trying to say and why it's important. So we touch on all different things like we talked about today: mobility, how to improve your technique, and different things like that. We just follow a couple myths that we talked about and go into detail. And the big thing is everything is supported by research. So I'm not just throwing out a bunch of stuff that I've had through my experience as a physical therapist and strength and conditioning coach, but I'm also basing it in research, and I give you that. So if you're a big muscle nerd like myself, you want to go out there and read the research, I give it to you.
Mm-hmm. And also, do you have a chapter in there about skincare? Because you have amazing skin.
That's actually my second book. So
okay, good, yeah, excellent. And so they get this on Amazon. And is there any also for online coaching, or if anyone wants to reach you directly, what's the best way to do so?
Yeah, so I'm available on all social media. So Instagram, I think, is our biggest following right now. But I'm on Facebook at Squat University, Twitter, Snapchat at Aaron Horschig. All across the board. If you want to message me, squatuniversity@gmail.com. Send me an email. I try to get back to every single person that reaches out. It might take a while, but I will sit there on a Thursday, I kid you not, and for 4 hours just sit there and reply to people.
Wow, man. Because your following is huge.
I have the most appreciation for every single person that wants to follow and learn and interact. I understand how it felt when I got an email back from someone that I looked up to a lot when I was younger. And if I can even in any way help anyone out that has reached out to me in any way, man, I'm going to do it. And I'm going to take the time, and I'm going to find the time to do it. It may be a couple, a month or so before I can get back to you. But if you email me, direct message me, I will do my best to get back to you.
It's funny too. I've been following you for a long time, and a lot of people in the gym and stuff, I'll see them do something, or they'll say, "Hey, do you know how to fix this?" And I'll say, "No, but I know someone who does." and then I lead them right to your site, because there's always something like the ankle, the knee, or whatever. There's something on there to show them, and it's like you said, it's not a long, drawn-out thing. It's a 2-minute clip of just, hey, take a look at this.
And dude, as smart as you are,
I
mean, it was crazy how refreshing it was when you're like, I asked you something about the deadlift, and you're like, this is a little outside of my expertise, but coming from a strength, and you said it's like, that's when you know you're confident and you know your stuff, when you're like, look, this is my expertise. I know this shit. I can help you out here, but this is really my my wheel well, right? Where like a lot of people try to be like, I know everything, ask me anything type deal. And that's when there's no such thing as somebody who knows everything, right? So
man, I'll tell you this: you are never, in my opinion, the people who are experts out there who know everything, man, they're really not the experts.
Yeah,
you never should stop learning. Every single day, I'm trying to learn something new. Reading research, reading another blog. I'm trying to better myself so I can help others out as well. I'm the first to tell you, don't call me an expert in anything, because I'm still trying to learn myself. I'm just trying to do my best to help others as much as I can in what I've learned. I've had a lot of experience. I've had a lot of, things that I've learned across, my path, and I'm trying to just help others out as much as I can with the experience that I've had. But, I think as a leader or someone that is put in a position where you can help others, you never stop learning, and you never become an expert in, that should be the mindset, but you should always be trying to grow and improve your ability to reach others.
Yeah, once you call yourself an expert, you think you know, so you stop reading.
Exactly.
That's the problem. I know what you mean.
You should never stop learning.
Yeah, if you tell yourself, like, no, I'm not an expert yet, you still got that hunger. I got to keep looking, keep uncovering, new whatever, the studies or whatever. Keep reading the blogs and expanding.
Exactly, and that's the first thing is I'm the first person to say I don't know everything, but I do know a hell of a lot on a couple things, and I'm going to try to tell you.
I probably know more than you. Put it that way. That's me saying I don't know everything. I probably know more than you do, so I'm going to help you out.
In the end, my goal is to help others. I'm not here trying to make $1 million off of this. I give away my best information for free, because in the end, my goal is to help others, perfect their movement, lift as much as they can. And, when you get an email from someone saying, hey, man, I had pain in my knee for 9 years. I tried everything. I couldn't exercise. And, man, now I'm lifting pain-free. that means the world to me.
Yeah.
I don't need your $30 to enter this 8-week course to do this. But if you can email me and tell me that, man, that means the world to me. And gratitude is the one thing that I have, I'm so honored by when I see other people follow and spread the word. And like you said, hey, I know a guy on Squat University, he can help you with that, man. That means the world to me.
Yeah, okay, so I appreciate you coming on. I'd love to have you on again. And man, talking to you, I want to pick up your book myself. And that's no lie. I'm not just tooting you a horn here. It's interesting stuff, man. So many things that you hit up on is just totally replies to myself. I bet a lot of people watching like, holy smokes. So, yeah, I'm looking forward to grabbing that book, and thank you for coming on. We really appreciate your time.
Hey, you're very welcome. It was an honor to be on. We'll have to do it again sometime.
Absolutely, Aaron. Have yourself a good day, buddy.
Thanks, you too.
Yeah. Bye-bye. Holy smokes, does he know his stuff, man.
Now you know why I wanted him on.
Yeah, and it's no lie. When he's talking about, like, his book being like everybody has some shit going on whenever they're weightlifting. Everyone does, especially, and squat is something that everybody does and everyone should do. So if you could get a book and you skim through, like, this is what's happening to me. So if it skims through, like,
chapter
the diagnosis, yeah, and you're like, okay, so this chapter, you don't have to read the whole thing. There's certain things specifically for you, so you touch up on, okay, here's what the chapter I need to read, and he's like, here's what you got to do. Don't focus on every freaking thing,
but
and try to do everything.
Here's one for you. Tell me a coach that couldn't use this book.
Tell me anybody could, yeah.
But not just an athlete, like you said, an athlete being able to pinpoint, what's specifically
for himself.
wrong for them.
But yeah, for a coach to
for
be
a
like,
coach, I mean, you have if you have 20 athletes, not one of them is a damn same. You're like, okay, listen, you know what? We're gonna go through some stuff. Show me a coach that couldn't benefit.
It's not even like where you have to memorize the book front to back. It could be like, you know what? Let me consult. Let me get back to you. Okay, and then you do your research through and be like, fuck that, let me try this with this guy.
Yeah.
Or this girl. Yeah, no shit. Like, that's no lie. I'm going to pick that book up. It sounds fascinating, especially in terms of, like, correcting everybody's got something.
Well, not just as a coach, but
as
a coach and an athlete. I mean, for you, it's
yeah.
Because there's a lot of things on there we touched on, and let's face it, we touched on a lot of stuff that happens to us, not just what we see, but also we were looking for different things that happen to us.
Some of us you can relate to, like, this happens to me.
My knee dips, my ankles.
Like, I don't have any problem, so I was thinking about you. I was trying to think, what do I have? Well, nothing. Yeah. How do you help me with having a big head day? Right? I have so much money in my bank account. How do I spend it? He can't help me. But,
I like the fact, though, one thing he corrected you on was the first thing he said was, I'm not an expert.
Yeah.
But we know why. And the thing is, looking into it. But
I know his mindset. He is an expert. But as soon as you tell yourself that, you're going to stop.
Exactly.
It's true, though. You know what? I didn't even think about that. But it's true, though. Once you say, I got this shit on lock. I know this. Once you say that, you do mentally stop looking into things. You just do. It's true. Everyone's done it with something in their life. And then all of a sudden later on, like, holy fudge, I'm starting to fall behind. Why? Because I stopped looking here, thinking, I got this covered. I'm going to look over here. Even if you don't say you're an expert, you're just like, I'm good here. Let me focus on these weaknesses. And then all of a sudden, you're like, I never thought this would become a problem. With whatever. I'm speaking generally, but it's true. Mentally, keep being hungry as much as you can.
Well, like I said, the little things, like I followed him for quite a while now, and I find little things just I'll watch and see if something tweaks. And I swear, every time something happens, it'll come up on his thing. But one of the ones is when we were messing around with, like when I was messing around with low bar, I started noticing a lot of hip pain, and it was his talking about the shoes as being in the heels over the flats, and as soon as I switched to flats, the pain went away.
Dude, flats changed my life. That was actually, we had Joy Flex on. He was talking about low bar, try flats, spread the feet out, blah blah blah. I'm like, maybe I'll try that. No shit. It was a huge game changer. Yeah. You just got to keep like quick little conversations. And the more guys we talked to, but and I love the fact that I asked him a little bit about deads, because he was talking about cleans, not just squat. He's Squat University, but he was, I think he's more, well, he said he's more Olympic lifting background, but obviously squat is for everybody. So I'm let me throw something out there about deads, and he's quick to be like, all right, like obviously he knows, I'm sure he's fucking knows a lot about it.
He does.
But he'll tell you straight up, and it's like, man, this dude, like that's how confident, that means to me that you're more confident when you can tell somebody, this is my expertise, but here's what I know. I'm going to tell you what I know. we're starting to drift away a little bit away from my expertise. That's confidence.
Well, the big things we wanted to touch on today is things that, especially new lifters and even a lot of old lifters, I mean, their mindset is so set on what they're doing, or they'll mimic.
We all know that dude, the older dude, the other girl who thinks,
or the new people starting off that heard from the one good lifter. You know, they'll
don't do this, don't do that.
They'll mirror the body.
And they don't know why.
They'll mirror the body though. So two people that look exactly the same is like she or he is exactly my build, exactly my thing. Why can't I squat like them? And that's kind of why I wanted to touch base on the genetics too. It's not just the levers. It's not
everything.
It's not just the levers. It's not just it's the genetics in there too, like that play a big part.
So I swear to God, man, like I touched up on just with a squat. Some people are like, I don't do low bar. That's a bastardized version, and because they see an Olympic lifter talking like that, but it purely translates to their sport. But if you're not an Olympic lifter, man, it doesn't. Sometimes people you repeat things and you don't even know why, and it's just silly talk. You know what I mean? And you see it a lot like you're the old guys stuck in their ways, or the young guys who are uber impressionable and they see someone they respect say something, it's like it's not always the case. So keep it open mind.
Before we wrap this up, to the viewers, we found the squat guy. Who do you guys want to see for a deadlift guy and a bench guy? Somebody that's going to give us this kind of information, or of that we don't know,
this guy's
that we can interview. Yeah,
I want to get a doctor. That was like crazy deep.
Crazy deep. But the thing is that he wasn't he threw out some terms that people don't recognize, but his overall explanation was very basic and simple.
He never lost me. I ain't a bright guy, so that's good. No, he was. You could tell he was coming from a medical perspective, as well as I hate going to you're not my family doctor if you're watching, but if you go to a doctor and you talk to him about some pains and shit, and he's like, I just don't lift as much. It's like, well, thanks, dude. Or just stop squatting then. Or it's like, God damn, man.
Take a better vitamin.
Is that it? That's it? Just don't lift. Come on. Whereas this dude,
stretch.
Whereas this dude, he's a doctor and he's into weightlifting, and so he can bring them both. And that's
especially powerlifting as fast as it's grown. The worst part right now is shitty coaching and people pushing ideas onto each other. And the thing is guys like this are refreshing to listen to, because even the simplest thing is a stretch. When I see 20 people stretching, you shouldn't all be in hip circles.
Yeah, if you know what I mean, because your buddy's doing it, your boy's doing it, he doesn't have the problem you got.
And I'm not knocking people taking buying a hip circle, whatever.
Well, but you're trying to do something.
But his book is what it's saying is that these are the problems you have. He realizes that you probably only got an hour and a half, 2 hours in gym if you're lucky to go train. Yeah. Don't waste an hour training or stretching something that doesn't matter.
Yeah, that's not your issue. That was his.
Yeah.
You seen him doing it. He's high level, so you're going to do it because he's doing it.
Yeah.
You could be wasting your time.
Exactly.
You have other issues that you need to address. And that's why, not to pump this guy's tires, but that's why his book would actually, for real, help. Big time. Save time.
Well, it's a lot of coaching. A lot of gyms could benefit. There's a lot of things, people that could benefit from this. A lot of personal trainers out there that could benefit from this book, I'll tell you. But anyways.
All right.
Let's end this one. Thanks, guys.